I've been practicing for over 10 years and I've been seeing thousands and thousands of patients, helping them with this specific technique. Now, I want to go through what this specific technique is and how we go about getting the best results for our patients. Now, this technique that we practice is specifically called Gonstead Chiropractic. It was a technique developed by a guy named Clarence Gonstead, who really refined and fine-tuned his technique to be able to analyze the spine and then also how we go about correcting the structure of the spine as well. If you don't know who I am, I'm Dr. Robert Rosas with Ahava Chiropractic, and I make these videos because patients have these types of questions about these specific topics, and I hope someone out there in the internet world will benefit from this information as well. So let's jump right into it. So the first component of our technique is going to be the visualization process. Now, many patients come in with different types of symptoms, but they also come in with different presentations on how their body looks. Oftentimes we'll see patients with head tilts, shoulder unleveling, maybe some pelvic twisting or some foot flares. All this stuff helps us to gather as much information to understand what potentially could be going on within their spine. The second thing that we're going to do is what's called instrumentation. Now, when a joint shifts out of position, it gets damaged, it gets injured, when with that is not only just going to come pain, but also some levels of inflammation within the spine. Now, both sides of the spine should be relatively the same temperature, but the tools and the instruments that we use help us to measure where that inflammation is coming from. So as we run our instruments down into the spine, we get a characterized spike, and that's going to help us understand where a potential subluxation might be coming from. Now, the third part of the analysis is going to be what's called static palpation. Now, what we do is we gown our patients every single time they come in, which also helps us to use our instruments on the spine, but also we get to feel the spine as well. As we run our fingers down the spine, we're looking for what's called pitting edema, where there's more fluid and more of a boggy type of feeling. And oftentimes when we find that area, we start to push into those areas of the spine, and there is some point tenderness that can come with that as well. Again, all this stuff helps us to understand where a potential subluxation might be coming from. The fourth component to the analysis portion is what's called motion palpation. Now, when that joint shifts out of position, it doesn't move the way it's supposed to. It starts to decrease in its function. And oftentimes when we're moving the joints, we're looking for where those joints move really well, but then also we're looking for those joints where they're getting fixated, where they're stuck, and they're not behaving the way they're supposed to. Again, that also helps us to understand where the potential subluxation might be coming from. Now, the fifth component is going to be the X-ray analysis. Now, when we look at the X-rays, we're looking for the health of the spine, the quality of the health of the joints as well. Oftentimes we'll see bone spurs, disc degeneration, arthritis starting to develop, but also we look to see how those joints have shifted out of position as well. Now, we gather all this information and it helps us to get closer and closer to the actual root cause of the problem. And again, one of this stuff, if I just take one of these, it might help me a little bit. If I take another one, it might help me a little bit more. But when I get all 5 of these components and they work together, it will help me to narrow things down so we get to the root cause of the problem. Now, one of the components that we didn't talk about is the history of the patient. Now, we take a very in-depth analysis and we ask specific questions because we want to know how the patient's actually feeling, but also specific questions will be asked to help us to narrow down where the problems might be coming from as well. Now, a lot of times the patient experiences headaches. Sometimes that might be either in the mornings when they wake up or potentially in the evenings when they go to sleep. Now, a lot of times this helps me to understand what type of headache they might be dealing with. If it is more something they wake up with, it might be something more in the upper neck, more of a neurological type of headache. If it's something they have in the afternoon or in the evening, that might be more like a tension type headache, maybe something in the base of the neck or the upper part of the back. So again, the goal of our office is get to the root cause of the problem. When we do every single step along the way, this helps us to get closer and closer to solving that and understanding how we're going to go about fixing it. So we just talked about how we go about analyzing the patient and the spine. Now I want to go about how do we go about correcting the actual joint and the adjustment. Because really at the end of the day, how we go about correcting the spine is really what's going to get the patient the best results. Now, when it comes to the adjustment, we use these 5 components and I want to explain what these are. The first step of the adjustment is the positioning of the patient. This is why we use so many different types of tables in our office, because we want to find what table is the best in terms of getting the patient to relax and create as little tension within the spine as possible. Because when we go about correcting and doing the adjustment, the less tension and stress the patient has, the better the adjustment's going to be. The second part of the adjustment is the minimization of the rotation. Now, studies will show that the spine gets most stressed in a flexed and rotated position. That's where you're going to get more strain onto the joint, and we want to try to eliminate that as much as possible. Our goal is to target the disc because that's oftentimes what's going to cause the irritation onto that nerve, and if we can go about correcting that joint, get pressure off of the disc, that's where the healing will start to take place. The third is going to be the line of correction. Now, from our analysis portion, we're understanding where the potential subluxation is located at, but using the x-rays and the motion palpation, different things like that, it's also going to help us to understand how that joint shifted out of position, but more importantly, how do we go about correcting that misalignment as well. The fourth component is going to be specificity. Now, we don't want to just crack, snap, and pop a bunch of things in the spine. I always tell patients, if it's not broken, you don't fix it. And we only want to address the areas that need to have attention. Now, specificity is where you only hear in our adjustments maybe one pop, just because, again, we're trying to get as specific as possible. And that's why this is the next component, which is going to be less is more. I may only adjust one area, 2 areas, 3 areas most, because we want to be as specific as possible. So when patients come into the office and they tell me, "Doc, I feel great, I feel awesome," I know exactly what I did to get them better. The same is true is if someone comes into the office and they're feeling like, "Man, I don't know what happened, Doc. I'm not feeling as great after that last adjustment." I know exactly what I did last time, so I know exactly what I need to avoid as well. And so less is more, because the other component to that is the healing part. If I adjust 5, 6, 7 different things in the body, now your body needs to heal those areas. But if I only adjust 1, 2, or 3 areas most, now your body can really send all the attention and focus into healing those areas, and you get better faster because your body's not focusing on healing the other parts of the body. And so, to summarize, this is why we get really great adjustments, because one, we're targeted and very specific. And the reality is we want to get the patient as relaxed as possible and minimize the amount of stress that we do when we go to the adjustment. And that's it. Honestly, that's really what it comes down to. These two components is one, the analysis and getting to the root cause of the problem. And then two, how we go about correcting the structure of the spine as well. I hope that helped you guys. If you like this video, please click that like button, subscribe to our channel to see more videos just like this. Leave some comments behind. Let me know some questions you guys want to see in future videos. We'd love to hear your feedback. But thank you so much for watching. Have a great day. God bless. Catch you later. Peace.